Hi everyone, welcome again to the Empower New Nurses show. Today, I am just excited again that you're here following. I think we've been covering quite a few episodes that are so meaningful, and someone asked me to relate some of my experiences as in comparison to the early years of my nursing and what I've observed today. Well, definitely in nursing has changed, and the world is constantly changing, and so does the profession, the nursing profession. And so I would say in the early years, a nurse would be more silent than now. It's in that time the doctors would be the one to give the orders, and to me sometimes they could have been more a collaborative effort, but it was like an extension of caring. But the doctors then saw the nurse in a different light, and I think that had to stop, and that has not been perpetuated. Nursing is a profession, and we have grown. We have now telemedicine, we have mobile nursing, and the going around mobility. It's so interesting. Nursing is a profession. It's not just the nurses who do a diploma as before. Many in those days were just a diploma. Nurses have gone back to school. Apart from that, they have done the bachelors. They put them in a different position. Leadership, more leadership opportunities are given now more than back in the days where you have nurses. A nurse might be at the bedside for many years, not because she might not have wanted to, but they would have said different people would be in that position, nurses. So we have come to a point now where nursing is a profession, and there are open opportunities for nurses to excel and advance themselves. Nurses are more outspoken now than early in my time, and we work as a team now, definitely. You have the rural nurses, yes, and you have the urban nurses. And of course, in the urban areas, you have more, I would say, more resources. You have the doctors and the interprofessional team at your, just like that. You do have them ready to go. In the rural areas, you will see nurses there for a longer time if they are covering certain cases. It's definitely they have to be skillful, knowledgeable, because there are certain decisions that they'll have to make quickly. If a doctor is on call, for example, the doctor would have gone to his home or her home, while in the urban area they are actually in the hospital setting or in the setting or the clinic setting, so that if there's the needs are there, they are met. We have come far. Advancement, technology. Nurses are specializing more now in informatics, technology. Earlier in my time, we had somewhat limited specialities. You'd hear about midwifery, critical care, maybe dialysis, and so. But these extensive informatics, anesthesiologists, and so forth, they are more in this time. You have the nurse practitioners, and practitioners, when I say that, that means that we have practitioners specializing in family, in pediatrics, in GYN, just in various specialities that we have the nurse practitioners. And these are registered nurses who have done advanced degrees, the masters, and some have gone on to their DNP, opening their own offices or practices. So nursing has come far from my experience, what I've seen over the years. And of course in academia, it flourishes. So we have young nurses out there who sometimes are wondering if they should go into the nursing profession. Someone asked me even today, what are some of the characteristics of a of a nurse, but of a good nurse, then I would say, she asked, and I said, definitely one of the first things that I would think of, that person should have a warmth within them, that they really want to help somebody, they want to help mankind. A caring, this one of the characters to be a caring person. And you think of that person should be respectful. That person has to know that they have to spend time studying. It doesn't come like that. It can be challenging. So you must study, be prepared. Come with an open mind and be willing to learn. The sciences, definitely, it's time that you must spend. Be able to communicate. Be willing to learn what you don't know. And be visible. Show interest and ask questions. Those are some of the characteristics, in my opinion, of somebody who wants to care and be one who delivers the best care or the high quality care. Be willing to research, use up the resources that are available, and go beyond. And you will see that success will be yours, not only for the patient, but also for yourself and for others. Patient-centered care is the key here. Regardless of your own personal feeling, you have to remember that the patient comes first, and you should acknowledge the patient for who they are and be prepared to give culturally sensitive care, because everybody is different. No two patients is alike. So it's important that as one prepares to give care, those are some of the things that you would want to have within you or try to pursue in order to be a successful nurse. It's a wonderful profession. It's very rewarding when you have seen that you have cared for someone who was almost dying or was resuscitated because of your insight and your critical thinking and all of that. That all of those components help to ensure that a patient receives good care, and you will be rewarded. That inner satisfaction that you receive, no one else, experiences that but you within yourself, and the joy that you receive from that. No one can take that away from you. When you see a patient smile after you have given some care, and you have been able to assess and see that upon your evaluation that patient is going in the right direction, that is just phenomenal. And sometimes it's so miraculous, because having worked in the critical care area for many years and seen some cases that, wow, they might have stayed long, but you see that person walking again, it's just almost incredible. But it happens. And of course, having empathy is another component. You must throw yourself in that person's, try to experience what that person is going through, as if looking through the lens of doing to others as you would have them doing to you. Throw yourself into that person's feeling or situation and see how you can resolve problems. It's amazing. But as I said, that's the only profession I've had for many years, over 40 years, and it has been rewarding. Of course, there had been challenges, but we would say the good pieces are real, and it's great to be a nurse, and a true and dedicated one. Not one just for the money. Money is a part of it, but your core reason, your main reason why you had decided to be in nursing. And it's a sacrificial profession, because you've sacrificed yourself so many times to care for others. So those are some of my pointers as I was asked to compare from my personal experience, some of the areas that I've seen changes occurring since my period or my journey in the nursing profession. Thank you. Now, this is Miriam Smith, DNP. This is the place to find me. Where? Okay. You can find me. You can connect with me on YouTube at Miriam Amanda Smith, Empowering Nurse, the New Nurses Show. In addition, Podcast Mir on Instagram, Facebook, Spotify, Apple. Thank you. Thank you. Subscribe, comment, and give your suggestions. Will be greatly appreciated. Have a great day and enjoy the sunlight.